Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Today's tip is about what are complications of a tracheostomy. I've done countless of videos, when to do a tracheostomy, when not to do a tracheostomy, when to avoid it, but I haven't really talked about what are complications for the procedure in and of itself, because we are working with a client at the moment who has actually asked that question. So I jotted down some points and talk about the complications of a tracheostomy. Obviously, one of the number one complications is bleeding. Many patients in ICU are on blood thinners, also known as anticoagulation, and that often needs to be stopped before a tracheostomy is done so that the risk of bleeding is minimized. But just stopping anticoagulation won't rule out the risk for bleeding completely, because the surgeon or the intensivist, depending on whether it's a surgical tracheostomy or a percutaneous tracheostomy, might just hit a blood vessel that can cause severe bleeding. Now, other complications could be damaging the larynx. That could be a further complication. Damages to the esophagus, which is rare, but again, it can happen. Trapped air in the surrounding tissues, also known as a surgical emphysema, right? That is definitely a complication that I have seen happening. Lung collapse, also known as a pneumothorax, that is definitely a complication that can happen. Blockage of the tracheostomy tube by blood clots, mucus, or the pressure of the airway walls. Failure of the opening to close once the tracheostomy tube is removed. And lastly, of course, the tube may come out of the trachea. That is also a complication, right? But then that's where you need, the bedside nurse, or if your loved one is going home with a trach, that's where you need a nurse with intensive care at home. And you can find more information here at intensivecareathome.com. So those are the complications in a nutshell. Now, I have also done a live stream about advantages and disadvantages of a tracheostomy that I will link toward below this video. I have done other videos and blog posts, such as how long does a breathing tube or an endotracheal tube stay in before a tracheostomy is needed? When should a tracheostomy be done? So I will link to all of those articles as well, so you can read further. I hope that helps. Now, we have a membership for families of critically ill patients in intensive care, where we answer your questions if you have a loved one in intensive care. And you can get access to our membership at intensivecarehotline.com by clicking on the membership link, or by going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy for families in intensive care over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. I talk to you and your families directly. I talk to doctors and nurses directly, and I ask all the questions that you haven't considered asking but must be asked, so that you can have peace of mind, control, power, influence, and that you can make informed decisions. I have worked in intensive care for over 20 years in 3 different countries, where I also worked as a nurse unit manager for over 5 years. I have been consulting and advocating for families in intensive care for over 10 years as part of my intensivecarehotline.com consulting and advocacy service. And you can look up our testimonial section to look at the results that we're getting for clients with our consulting and advocacy. I also represent you in family meetings with intensive care teams, so that you have clinical advocacy, clinical representation. Once again, I will ask all the questions that you haven't even considered asking, but must be asked, so that you can make informed decisions, have peace of mind, control, power, and influence. Also, very important to consider prior to a family meeting with intensive care teams whether you should even go there. I will strategize all of that with you. What's the best course of action? We also offer medical record reviews in real time, so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com, call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share the video with your friends and families. Thank you for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.